Okay, hi everyone. My name is Elizabeth Ballarunwa, and I'm a rising junior clinical laboratory science major on our pre-med track at Howard University, and I'm a part of Glomed as an intern, and I'm a part of Mother Lab as a research assistant. Before we get started into any content, Imani is going to tell us a little bit about about Mother Lab.
Hi everyone, my name's Iman. I'm just gonna share some slides to introduce Mother Lab to you. Just to introduce myself, my name is Iman. I'm the chair of Community Engagement, Advocacy, and Policy. This webinar has been organized by our lovely Community Engagement Committee. Our liaison is also, her name is also Iman. She's on this call, Iman Ali. She has organized this, and we are working in collaboration with Glomed today. So just to introduce you to Mother Lab and what we do, we are a lab committed to reducing Black maternal health disparities, and we formed this lab a year ago, and it actually was our 1 year anniversary a few days ago. So our mission and goals are to address and eradicate inequities facing Black women, and we have a multitude of different ways of doing this through research, advocacy, mentorship, and our vision is a world where all Black women who would like to be mothers one day can efficiently and comfortably receive access to healthcare and all the support they need to have a healthy life, healthy babies, and be healthy mothers. So these are a list of our goals and objectives. And you can also find this all on our Mother Lab website, which I will be sharing more details about later. And in terms of our leadership, the one and only Dr. Ao is our principal investigator. She is the founder, the visionary, and the woman who made it all happen. She is actually a speaker here today, and she will be telling you more about our work and the amazing work she does. And our organizational structure is we have 3 different committees. We have research and grants, community engagement, advocacy, and policy, which is the committee that organized this webinar, and we have marketing and communications. And just before I hand it over to Liz, I'll also be sharing these slides later about how you can contact us, get involved, and here's the link for donations, which we will also be dropping in the chat later. But thank you so much, Liz, and I hope you guys enjoy the webinar.
Okay, so hey everyone again, and we are so glad to have you for our Health Equity Speaker Series and Summer Webinar in collaboration with Glomed. Before we get started, I wanted to share a little bit about who Glomed is. At Glomed, we aim to mobilize a community of students and grassroots organizers to improve the health of people around the world. Glomed students learn about health equity leadership directly from experts, our grassroots partners in Asia, Africa, and the Americas, and become a part of a movement for global health equity. We also believe in the power of community, which is why we make these programs available to everyone. Additionally, these programs are possible because of the generous support of the community. I'll be dropping a donation link in the chat for you guys to invest in this sort of programming. And with that, I'd like to hand it off to Iman and Rachel to introduce our incredible panelists for today.
Thanks, Liz. Good afternoon, good evening, everyone, and welcome to the Mother Lab Summer Webinar, Pathways to Working in Public Health. My name is Iman, and I am part of the Community Engagement, Advocacy, and Policy Committee, and have had the pleasure of organizing this webinar alongside Rachel, Liz, Iman, and everyone else on our committee. So I'm going to begin by introducing Dr. Ao and Heather, who are 2 of our panelists, and Rachel will wrap us up with introducing our other 2 panelists. Dr. Amutah-Onukagha is an associate professor in the Department of Public Health and Community Medicine at Tufts University School of Medicine. Her current research interests include health disparities, reproductive health, maternal and infant mortality, and HIV/AIDS in Black women. Dr. Ao is a member of the American Public Health Association and is currently the co-chair of the Perinatal and Women's Health Committee in the Maternal and Child Health section. She is the principal investigator of 2 multi-year studies on maternal mortality and morbidity, an R01 funded by NIH and an interdisciplinary grant funded by RWJ. Additionally, she is a member of the Mass COVID-19 Maternal Equity Coalition and was honored with the APHA MCH Section's Young Professional of the Year Award in 2019. She is also in the 2020 to 2021 class of the top 40 under 40 minority leaders in healthcare, an annual award given out by the National Minority Quality Forum. Finally, Dr. Ao is the founder and director of the Maternal Outcomes for Translational Health Equity Research Lab, Mother Lab for short, comprised of 35 students from undergrad to postdoc with a keen interest in reducing maternal health disparities as experienced by Black women. Our next panelist is Heather A. Olden. Originally from Durham, North Carolina, a doctor of public health student at Harvard T.H. Chan School of Public Health. She earned a Bachelor of Science with honors in molecular biology from Hampton University and a Master of Public Health in International Health Epidemiology, cum laude, from the University of Michigan, Ann Arbor. In her former position as an epidemiologist at Henry Ford Health System in Detroit, Heather specialized in patient and community engagement, strategic planning, program development and management, and qualitative data collection and analysis for both internal and external health system clients. She has presented at multiple national academic and patient advocacy conferences and consults with health systems across the country on how to effectively entrench patient engagement into complex organizational health systems. Her research interests are centered largely on the impact of social justice on maternal health, as well as on using patient engagement methodology to authentically translate research into clinical practice and policy. Following completion of her doctoral degree, she plans to leverage the diversity of experiences to bridge the gap between maternal health research and social justice policy. Her vision is to create a pipeline from research to policy development that is grounded in the voices of those with lived experiences. And now I'm going to pass it on to Rachel.
Hello, everyone. My name is Rachel, and I'm also part of the Community Engagement Advocacy and Policy Committee. And I'll be introducing Dashanna, who is a birth and postpartum doula serving Massachusetts and New Hampshire. She also teaches childbirth education courses and specializes in helping parents create their life after parental leave. Caring for Mamas is Dashanna's way of starting the conversation about how families navigate these transitions and what postpartum care looks like beyond the first 12 weeks. The next panelist is Jaycina Almond, who is the executive director of the Tender Foundation, a model, and most importantly, a mama to a 4-year-old baby girl. Her journey into motherhood also informs the work she does with Tender. At Tender, they are bridging the gap and providing a safety net for single moms living on the margins in Atlanta by providing financial assistance with rent and utilities, grocery store gift cards, and operating a diaper bank. In 2020, Tender was able to distribute over $83,000 in financial assistance, keeping 78 families in their homes, paying 41 utility bills, and providing grocery assistance to 38 mothers. And now I'll pass it on to Liz.
Thank you so much for introducing our incredible panelists tonight, ladies. So before we get started, I just want to say that this is a space for us to learn from each other and for us to, give some advice and learn about how we can be active leaders in Black maternal health and public health in general. So with that, I'll get started with our first question, and anyone can answer it. Hopefully we have time for everyone to be able to answer each question. So what was your educational/professional background that led you to your current position?
Okay, I'll start us off. Good evening, everyone. Such a pleasure to be here. Thank you to all my wonderful students from the Mother Lab. Thank you to all our guests. It's really a pleasure to be here with you guys. So curated an excellent event. Educationally, you guys heard it in the bio, a BA in Africana Studies, BS in Public Health, and then a master's and a PhD in Public Health. But even if you don't have, the formal education in maternal child health or public health, I think what brings you to this work and maternal health work is a real passion for the work and a commitment to addressing disparities. And so whether that's through lived experience, whether that's through doula work, midwifery work, or formal academic credentials, we all find ourselves in this work for the love. And so oftentimes when I give these types of talks, people are like, well, do I have to get a PhD? I'm like, if you want, but if not, you can still do the work, from your heart, and connect yourself to organizations like Mother Lab, like Caring for Mamas, like Tender, who are doing this work organically. So I always put that caveat out there that don't feel the need to walk this particular path academically. It's a very linear, long path. If you want to walk it, I'm here to support you in that journey. But if you're doing it from your heart, you'll find ways to engage with the work that don't necessarily have to be tied to the academics. Thanks.
I'll jump in because I think I'm the only person without like an academia background on the panel. So speaking to that point, my journey into motherhood kind of brought me to doing this work. I was 20 when I got pregnant, and only a few months prior to learning that I was pregnant, I was like calling my mom and begging her to beg her dad to pay my $300 rent. So there's really no difference between me and the moms that we serve for Tender. This is how I grew up with a single mom. The only difference is that like a few months into my pregnancy, my daughter's dad managed to become like successful in the music industry. And then the doors were opened so I could have the resources and access to parent the way I want to parent and have the delivery I wanted to have. I was able to like change to a midwifery and have the birth that I wanted, but only because I had monetary access to those resources. So that journey led me to doing the work that I do now.
So I guess I'll go next. I do have a degree, but I have an English degree, so not related at all to what I do now. Obviously, yes, becoming a mother, being a community with mothers is how I got here. I became a doula. I do have like a doula certification. I do doula trainings all the time because I think knowledge is power. It's so important to understand birth, understand pregnancy, understand the people that we're serving. And so I'm always a student, right? Like of all of us, right? I think we're all going to be learning for the rest of our lives. But those are my like formal kind of trainings as far as like doula work.
I guess I can share. Hi, everyone. Thank you so much for having me. It's an honor to be here. So you heard my, I guess, educational background in my bio, but I think, and this is not something you put in a bio, but I initially wanted to go to medical school. And I spent a lot of time and money preparing for that, and sort of had an experience with, I didn't have the greatest advisor in my latter college years to kind of say, hey, there are other opportunities out there, such as public health. And so I happened to get an internship just because, you have these conversations when you're graduating, you're talking to your mentors and like, oh, I know so-and-so, And so I was moving to New York City, and a faculty member that I had been working with, I was their TA for like 2 years, was like, hey, I have a friend in New York. You should do this internship. It might not pay, but it could lead to opportunities. So I took it. I had probably 5 other jobs so I could pay, bills and such in New York, but I took it, and it was an unpaid opportunity and it exposed me to public health. But how I got into maternal health was actually the job that was mentioned, the Henry Ford job. My first job here was working as a data manager with a program called the Women Inspired Neighborhood Network Program. And it's a program aimed at reducing infant mortality. Excuse me, there's a fruit fly in here. And the reason being, Detroit had very, a lot of infant mortality, especially in the African-American community. And so I started there as a data manager, and I got to know the women and the mothers and the stories and the experiences. And being the empath that I am, I just fell in love with just being around these women and being in this community. And given my personality and some of the experiences that I had in my internship, and as I was a focus group facilitator when I was living in New York, as one of my 5 jobs, all of that kind of led me into patient engagement and working with moms, and that's what led me to where I am now. But I guess I can talk more about that later. Thank you. So just going off of that, is there anything that you would have done differently in terms of school and just like, choices, maybe changed your major or something like that? Anyone can answer.
Yes. I would not have had such tunnel vision when I was in college and right after college. I think I told myself and I told all my friends and all my parents' friends that I was going to be a physician. And so I was going to be a physician. And I think I missed a lot of different opportunities in learning there are other ways to have an impact on the world, the way that I wanted to have an impact on the world. And it didn't just have to be in medicine.
I think everyone was shaking their head like, yes, like, yeah, we would do something different. I have an English degree, right? So the purposes of like my business and my life, having an English degree has been pretty sweet. I mean, it's been really helpful. I mean, I write blogs, all that kind of stuff is nice. But did I have to do that to do this? Absolutely not. And had I known that there were all these other ways to help Black women. I originally went to school being pre-med. I changed to English in my second year after being exhausted and overwhelmed and really just loving books and writing and all that kind of stuff anyway. But there are so many pathways to pursue being part of this community, right? Being in maternal health. And I think this is such a great panel to do things like this, but these things really need to be wider cast, so that people know there are other options. Get into them earlier. The earlier, the better,
And then, so this is going to be one of the last questions on the educational part, but what are some ways that you guys think that we can bridge the relationship between academia and fieldwork? Because I think for me, at least, it seems like there's just two big cliffs and there's no connection.
I have some thoughts I could share about that. They might be a little controversial, but I think that in academia, so when you say field work, do you mean like the community work?
Yeah, just actually being in communities and helping mothers.
I think if the incentives in academia for things like tenure or, the things that people want in that academic world, if they were tied to more community metrics. So if they were required maybe more than they already are, and I'm not a faculty member in any way, so I think Dr. Ayo can speak to this a lot better than I can, but from the perspective of a doctoral student, it seems like if we tied more incentives in academia to the community, maybe we could help to bridge that gap, as well as bringing the community into academia. So finding spaces for them to be able to thrive.
Speaking to that point, I think that's true. For the work that we do, we always say that we make like community informed decisions, meaning there's certain touch points that we have with our clients where we receive feedback from them, and then we use that data to decide where to adjust our programming, et cetera. And I think that policy comes from folks in academia. And so I think if there was a touch point to where people living and the experiences that people are learning about, and there's feedback, then policy could like be based on what those people actually want from themselves. And like those decisions could be community driven. So I feel like there just needs to be more of a way to get actually like real lived in experience, like tied in to what, is being taught.
Yeah, I would agree. I think, for me, I've had a very linear public health path. But one thing I will say to people, I tell this all my students in the Mother Lab, and this is one of our strengths really, is about connecting with community-based organizations and really being of service to the community. So like Heather talked about having that unpaid experience and just, going for it. that's really how public health is. And that's how maternal health works. Is one, it's about your network. Two, it's about, your experiences. And three, it's about putting yourself out there. So of course, getting paid is good, but I've done every kind of job in public health you don't even know, right? And I've done it, one, for the love, but two, for the connections, right? Like I can say I've worked in the health department, I've worked in the federal government, I worked in the community doing HIV testing, I've taken urine samples from people. Like, I've done every kind of job in public health that there is, because I'm trying to saturate this field. So don't feel bound to one particular position or another. And the other thing I want to say is, please do not limit yourself when you see something that says 3 to 5 years experience, or those things are just indicators for me. That's like, it may be what they're actually looking for, or maybe that you are who they're looking for. So you still throw your hat in. You never take yourself out. You never, ever don't bet on yourself. You know what I'm saying? You let them tell you, oh, we're looking for somebody with 5 years. I'm like, okay, cool. But you try. You still put your stuff out there. So I would just say diversify your experiences. Don't be afraid to take unpaid labor. And literally, I didn't say this at the beginning, but how all of my Mother Lab students got to be here, one way or another, they connected to me. They were like, either saw me give a talk, I came to speak to their class, I was their professor, they saw me in the grocery store, whatever it was. They were like, listen, I'm trying to get behind what you're doing. How do I get behind what you're doing? And I was like, cool. Mother Lab was not here before the pandemic. Mother Lab was born in the middle of a pandemic because people are looking for opportunities to get connected. I saw an opportunity to have a national network. We got people here in Detroit, Texas, Jersey, California. Mother Lab is a national lab. We are not Boston based. So, I would just say, at the end of the day, you have to bet on yourself and put yourself out there in a way that at the end of the day, you are building your experiences and you are building your network, you guys. I cannot say that 10,000 times enough. Your network is your net worth, period. So as it pertains to academic and community partnerships, obviously the academia has a lot of the resources that communities need, but we don't know everything. That's where academics get it messed up. You come in with your evidence-based tools and you're this and you're that. You want to fix everybody because you know better, and the literature said XYZ health disparities. The community is the expert. That's where the expertise lies. And so if you can bridge some of those relationships, if you can really strengthen those ties, both parts are going to be so much stronger for that. So I tell my students, forget what the job description says. You always bet on yourself. You put your application in regardless of what it says. If you don't get it, at least you tried. But if you don't apply, you'll never get it. Okay.
And then when you get in those spaces, you find space to bring in your community or that community, right? It's about getting in the room at the table. And Dr. Ayo is right. Literally, everything you go for, here's the thing they won't tell you. That person may not. So for instance, if I had reached out to Dr. Ayo and she didn't have room for me in her lab, let's say, because I think I was on the cusp, okay? We still have communicated. I've indicated my interest. So if the lab opens up later, hey, I'm already in there. Or if another opportunity is available. So it's just about that. I don't know if we talk about that. Like when you reach out to people, everyone's so nervous. What are they going to say? The worst they could say is no, but they always will remember you, or hopefully will remember you for another opportunity.
Thank you. So I have another question for you all, which kind of has to do with what you two were talking about at the end. And what are some areas that are in need, lacking, or gaps in the Black maternal health / health equity space?
I'll start, and then I'm going to kick this to Dashanna. One thing I can say is we just have not capitalized on the sheer urgency of doula reimbursement. And I will say that because at the end of the day, the ability to afford a doula, the ability to access the benefits of having a doula are paramount. And we know doulas are here to reduce maternal health disparities. People that have doulas have less likely to have a C-section, more likely to initiate breastfeeding, have more full-term birth weight babies. Like, doulas work, right? And doulas are an integral part of the care team for moms, particularly Black birthing people. So if we could get the insurance company to the table to play ball, I mean, you got their language is all return on investment. Their language is all, cost savings, benefits. listen, doulas save money because they save lives. If a baby is born full term, that baby's not in the NICU, which is a strain on the healthcare system. If a woman is able to, if Dashanna can come in and catch somebody that's having postpartum complications, Dashanna, I'm not even going to ask you how many of your clients this year you have intervened postpartum, okay, which we know is a critical fourth trimester, all right? If she can come in and say, you know what, sis, you look a little swollen and maybe you got some edema in your limbs, right? Like, are you having a headache? Are you feeling a sensitivity to light? How are you sleeping? Hey, let's check this blood pressure real quick, right? That keeps people out of the ER. That keeps people out of readmission, okay? Which brings cost savings down. So this piece about doula reimbursement, we got to get the healthcare and policy maker, they got to get that memo, because the ability and the privilege of being able to have a doula should not be reserved for white women who can pay $500, $1,500, $2,000. We need doulas in the Black and brown community like yesterday. Okay. And so that's a piece that I'm like, got my crosshairs in, because I'm like, we have to fix this. And so for me, that's one of the issues. That's one of the gaps. The other thing I'll say is just a sheer racism in the healthcare system. Like, we call it implicit bias, it's explicit racism. What these microaggressions that place Black women and Black birthing people at cumulative risk for having adverse outcomes is based on racism in the healthcare system. Those are the two things that I'm seeing. When I talk to my colleagues who are OBs and MFMs, I don't got no beef with you as a person. My beef is with the collective failure of your profession to support Black birthing people. You understand? So those are the two things that I see from a research, from a lived experience perspective, that we really have not begun to disentangle, right? And it's hard to tell people, you're racist. You know what I'm saying? That racism is playing out in the way you provide care. When you walk into a clinical visit, do you make eye contact? Do you sit down? Do you make the woman feel like her questions are valued? Is she crazy for telling you her symptoms, right? So at the end of the day, these are the things that that make a difference in outcomes. There's 20 other things I could say, but those are the two things that come to mind initially, is this piece about doula reimbursement, getting doulas paid what they deserve to be paid, because in my mind, they are doing God's work just like any other nurse or any other doctor that's checking your blood pressure and trying to save your life. So are doulas, honey. That postpartum care, that texting and that messaging and that checking up on you when you're pregnant, that social support, people need that. Okay, that changes outcomes. That, and we got to figure out how to deal with these racist providers. Thank you.
Yeah, you say everything. You don't need to kick it to me. Yeah, I would love for insurance companies to pay doulas, to reimburse us. I would love it. I would love for every Black family to have a doula. I crave that for our community. Seriously, it's overwhelming when you honestly see it in the flesh, when you see a client who, like, you get emotional. Really, I mean, my first loss like happened recently with someone who hired me a little late, but was clearly needing support, was not listened to, was not respected, and their son is not here, because they had preeclampsia, obviously, to me, but I can't declare you with preeclampsia. I can't write that in your chart. I'm not your doctor. I can say, have they done this test? Have they done that test? Okay, that's high. That's high. That's high. What are they saying? They're saying it's high, but they're not willing to make the actual call. Why? Because you're Black, because they don't want to be seen as racist, or because they already are, and we have to put our trust in these systems. We also need serious education. We also need to be seriously educated about maternal health, about fertility health. Maternal health, fertility health is not about just being pregnant. We have uteruses we don't use most of the time, like, for that purpose, but we still have a uterus. You need to know what it's for. You need to know what it does all throughout the month, and not just those 7 days when it's annoying you, I really want us to be educated so that when we walk in the room and we say, well, I got this, I don't need 17 other problems to be declared with gestational hypertension, I just need hypertension. Period. End of story. Write it in my chart. And have the confidence to walk away if they don't. You know what I mean? But we just say, I guess because you know better, because you have the letters after your name, because I don't know more is the truth, you know? And we really need to take education seriously. We really need to take doula seriously. I mean, as a doula, like I said, I became a doula because I didn't have one. I had a really great nurse who made sure I didn't have a C-section that day. And I walked out of that room going, we need to know more. Why didn't I know about this process? Why did I sign up for an induction? And I had no clue what medications they were going to give me, what they were going to say, what high blood pressure really was, you know? What are the numbers? What do they mean? All of that, right? I want that for all of us. Yeah.
Okay. So thank you. For our next question, I just want to ask Jaycina and Dashanna what you envision for Tender and you, Dashanna, for caring for mamas to look like in 5 years.
I'll go first. So 5 years, right now, we're actually building out a program that kind of explores the concept of a universal basic income, but targeted to single Black moms here in Atlanta. So we do gap assistance right now. It's just like one-time financial emergency assistance with rent, utilities, grocery store gift cards, and then the diaper bank. Ideally, though, 5 years from now, we will be shifting into something that is like a more long-term programming for these moms that need more than just, you know, I have an eviction notice, and once my eviction is paid for, still where's the money to pay it next month? You know, it's a cycle. So my goal is we're trying to work on something to do something long-term and like proof of concept, and then get the funding for it and all of that good stuff. But yeah, long-term support for our moms is my top goal for in the next 5 years.
So the next 5 years, man, I would love, actually recently a lot of people have reached out to me about mentorship. So that's something I'm thinking about in the future, training other doulas, working with other doulas to wider spread, you know, the message to the community, possibly becoming an IBCLC, because we don't have a Black lactation consultant in the state of Massachusetts. And that's a disservice, like, to our community. It really is. There are, you know, a couple of people here and there who do a few things, but that big, like, 5-year certification, that matters to people. And so to get that's something I'm, you know, think about for our community, for myself. Yeah.
And then Dr. Ayo, how do you see Mother Lab in 5 years?
Well, you guys know, and Heather's taken us through the strategic planning process as a research lab. For me, in 5 years, Mother Lab will continue to be the largest maternal health disparities lab in the country, putting out students from undergrad, master's, PhD, postdoc, nursing, social work, going into these respective fields with this maternal health equity lens. Like, we're training scholar activists. So that's what I see for Mother Lab. The other thing I see is, in my vision, is to have a center for Black maternal health. You guys have heard me say that in the lab, in our meetings, but there are not a lot of academic institutions that have centers of research that have community focus, right? Community engagement, training, workforce development. What we're doing in Mother Lab is ultimately training people to go into the public health and maternal health workforce. We're training clinicians, OBs, nurses, social workers, public health professionals. And so you're contributing to the workforce for people to have this training and this grounding in maternal health equity. So I see that continuing. I see a Center for Black Maternal Health and Reproductive Justice laying the foundation for that. Mother Lab is core at the heart of that. And I just see us continuing to be of service in both our local and national community. This issue around maternal health disparities is not germane to Boston or Massachusetts. It's a national issue. And I see us continuing to collaborate with other like-minded organizations. I love what Dashanna said about mentoring, because you're growing the field, you're infiltrating the field with more and more people that share that sentiment. And I just want Mother Lab to continue to grow. That's one of our strengths, and one of the things that makes it so beautiful is that we're interdisciplinary, we're intergenerational, we're intercultural, biracial, multiracial, like everything, religion, everything you want is here at the Mother Lab. That's how you permeate the field. We're not a one-trick pony. And I just want to see us grow. I want to see us gain more revenue. I'll be honest with you. None of us are really compensated for Mother Lab. I don't get paid for doing this. And, students, we get a little stipend here and there. So we need a funding stream, right? Like somebody needs to invest in Mother Lab for I need 5 years of funding. Just like Dashanna needs it, just like Jaycina needs it. Like we need access to funding to keep our stuff sustainable. Because I'm not trying to lose my students to Starbucks. And I'm going to beef with Starbucks, but y'all need to be doing work over here in the Mother Lab than making lattes, okay? That is a loss of resources and passion for me. So I need a funding source. I want to get a center. I want us to continue to grow. I want us to continue to do public education and community engagement, and I want us to be of service to our local community, right? So I think for me, Mother Lab's reach is both local and national, and that's what really makes us special. And I just see us getting bigger and growing intentionally, right? That's why we're kind of capped at 35, which is still a very big lab, but at least I can put my hands on my students. I can love up on them and say, hey, I know if we got 100 and 150 people, I can't put my hands on 150 people, but we're growing as people shift and go into the workforce, get new jobs, transition to medical school, whatever. I go back to the pipeline. We have a wait list to get in the Mother Lab. I go back to the pipeline and say, who else is on the wait list? Who can we bring in that's at an undergrad or master's or PhD, whatever level, to join this conversation and this movement? So I just see us continuing to grow, continuing to be of service, and continuing to be called to our purpose, which is everything we're doing here. This is right in alignment with what Mother Lab should be doing. These types of educational events, liaison with community, that's what we're here to do. We're not here to sit in the academia and publish articles and write grants and all of that. That's only 5%, 10% of what we do. And it's important because it keeps you in the scientific literature. It keeps you relevant in that way. And some people do look for those things for success. But Mother Lab is a community-based organization that happens to be housed in an academic institution. Thanks.
Thank you. This question is for Heather. I would like for you to just talk a little bit about specifically the steps that you took to become a Dr. PH, what that, or, as you're matriculating to become a Dr. PH, what that entails, and how and where you see yourself working after you graduate.
Okay, so let's see. I decided I wanted to get a doctorate degree mostly because I wanted to do my own research and I was tired of doing other people's research. I wanted to ask my own questions and sort of make my own print on the world. So I had to decide between PhD and DRPH. And that's a very long conversation. So if anyone's interested in talking more about that, you can share my contact information, because I really thought about it for years and years, about 3 years, being real. What do I want to do? And because I enjoyed the practical nature of my master's degree, I thought, okay, I think the DRPH is more in line with what I want to do. So in complete transparency, I applied and I did not get in the first time. And the reason I did not get in the first time, now that I can talk to, the admissions and kind of just get feedback, was because I had a very general application. It was like, yeah, I want to get my doctorate because I want to make my, my print on the world, and I'll figure out what I want to do when I get there. They were not buying it. And to be perfectly honest, my heart wasn't in that application. It was kind of like I had reached a crossroads in my life and I was like, I know I want to take this next step. Let's see if this works out. So I ended up at my job at the time starting to get more involved with, I was like moderating focus groups with pregnant women and working a lot more in maternal health. And I was liking it. And I was kind of bonding with some of the people in my department who was doing similar work, and they were sort of putting me on projects. I'm like, okay, this is pretty cool. But at the same time, outside of work, 5 of my friends had 5 to 7 of my friends over 3 or 4 years were having children, and none of their children were perfect births, as they say. And so when you start working in a certain space, and then you start seeing the pattern that you're talking about in meetings and writing about happening real life, you start making connections like, wait a second, I think this is what I want to, I enjoy spending time reading about maternal health and how, with Black women trying to figure out why we have different outcomes than our white or other counterparts. And so I reapplied. And this time when I reapplied to my program, I actually talked about why I wanted to go into maternal health. And it was the most honest and genuine thing. And when I wrote it, I honestly said, gosh, this sounds really corny. Like it felt it was from the heart, but it wasn't a very academic essay in complete transparency. It was just a letter to why I wanted to be in maternal health. And I got accepted. And so I think there are a couple messages that come from that. Be genuine to yourself, be true to yourself, follow your heart. It sounds corny, but really follow your heart. Have a conversation with yourself. When you wake up in the morning, and you might have heard this about like what people, when they say you're doing the right thing, when you wake up in the morning and you're excited to open a book about, for instance, battling over birth. I have a book right here. When you're excited to crack open the book, when you're excited to go facilitate a focus group, when you're excited to really talk about the work that you're doing, that's when you're in the right space. So when I got into my program and I started taking some maternal health classes, I was enjoying the maternal health classes more than I was my other classes. So that's really how I got to the program. And then as far as when I leave, when I got into this program, I wasn't thinking very much about academia and complete transparency. My mom was in academia, and I just didn't know much about it other than being a family member of someone in academia, which is very different from being in it yourself. And now that I have a little bit more exposure, probably because I've finished my first year of the program, I'm open to being in an academic space because I see the power. I don't want to say power. I see the role that I can play. I see a space where I could really thrive. But at some point, I stick to this, I really would like to create a space where policy and research and, what we do in the clinic, I want to create a space where all of that sort of comes together. I don't know what that looks like. Every day it gets clearer, every single day. So I think as I go on this journey, it'll become more clear. Ask me in a year. But for now, I'd be comfortable starting in academia and then sort of transitioning into a more community space.
Thank you. And in the spirit of this being kind of a panel for careers in maternal health and public health, I just want to ask, what are some ways for students to get hands-on and like really on the ground experience while in undergrad, and also how to navigate pursuing multiple degrees?
I'll just say really quickly, listen, go for it. Going back to what Dr. Ayo was saying, even if it doesn't pay, if it's interesting to you, go for it. The other thing that I did that I thought was really helpful is I kind of keep a list of skills that I want to attain and really refine, but also topics that interest me. And over time, I scratch out and kind of add to it. And you find opportunities based on those lists. So if there was something a while ago, I really wanted to learn how to do mapping. For some reason, mapping was really cool to me. So I tried to find an opportunity where I could do mapping, and I did mapping with HIV and Harlem, so keeping a list was really helpful for me, and I highly suggest it. And taking time to think on your list and really be thoughtful about it, right? Because this is your future would be my biggest advice. And then creating boundaries for yourself when you do find opportunities is very difficult. So I probably wouldn't be the best person to give advice on how to create boundaries because I'm learning myself, but just being mindful of your obligations and what you're getting from them and also what you're putting into them is really important.
I am the worst person at setting boundaries when it comes to things I'm involved in. And I think it was easier virtually because you could kind of put your hands into multiple different baskets. So that's kind of what I'll miss about being virtual. But yes, definitely setting boundaries about what you can and cannot do, because there's only 24 hours in a day. And I feel like you'll know when an experience is going to further you, like, emotionally and like in your own career, like not even looking at what it's going to get you in the future, but you'll know when an opportunity is for you. Yeah. So Dr. Ayo, I'd love to hear what you'd say about getting multiple degrees and experience while in school.
Yeah, I literally had a conversation today with an undergrad. So just to tell you guys, I get, I don't know, 100 emails a day. Somebody want to meet with me about something for something about something. And so, I had to finally break down and get some administrative support. I know my students are laughing because they're like, yeah, Dr. Amutah, you are horrible with the email. But I'm better now because I got somebody checking it and she be on it. She checks it. Here's priority, Dr. Amutah. You got to get this done today. She has a task and she's whipping me into shape. So those of y'all that have been around for a minute, you like, oh yeah, at least I get a response now. But I said all that to say, there was a young lady I met with earlier. She's an undergrad. So she just finished her second year at Tufts. Now, this young lady probably emailed me 3 times. She want to meet with me. She want to hear about my career. Okay, cool. So you know what my new system is today? And I was just telling TJ, who's my admin person, I said, TJ, listen, anybody that emails me that wants to get a meeting, here's the criteria they got to go through. First of all, capacity bandwidth is 150%. I'm overextended. But there's a way to tell the students that are serious, right? You're going to get the traction with somebody like me by doing your homework. If I had $1 for every time somebody was like, tell me about your life, tell me about my whole life is online. Google.com, ddamutahphd.com, motherlab.org, amakaconsultant.com. You can find me, Twitter, Instagram, Facebook, LinkedIn. Just do the homework. You know what I'm saying? Come to the meeting with some specific questions. Come with an agenda. I want to see your level of clarity and preparation. You only have one chance to make a first impression. That is so cliche, but it's the truth, honey. And I'm always going to take meetings. Shout out to my Black and brown students. I'm always going to make space for my Black and brown students, because I know when I was in school getting my master's, PhD, undergrad, you can't get with professors. We trifling. They don't respond to email. They going for the summer. We just fade to Black because we can. There's no accountability and there's no consequences. That's the truth. So for me, I always said I was never going to be that type of professor. I was going to hold space for everybody. It might take you a little bit of time, but let me tell you about this undergrad today. This young lady was so diligent. I just had to go back and look and see how many times she emailed me. She put me on the calendar. Hey, Dr. Amutah. Hey, Dr. Amutah. Like, she just kept hitting me and hitting me and hitting me. Then she hit me. And now TJ's at the table. So TJ got her schedule. So I got on a call today. I was like, she had her agenda. She sent the agenda in advance. She done did all her homework. She was like, I read your paper on HIV about this, and this. I want to work on an HIV study on this, and this. Do you know this girl's about to come on like 3 of my studies? Why is she coming on 3 of my studies as an undergrad? She doesn't have any research experience because she took the initiative to do the homework, right? And she was diligent and she was unapologetic. She was like, listen, you're going to get this meeting, whether it take me 6 months or a year. I was just so impressed at the maturity and preparation. Because when I was 19, I was not doing that. I was having my hot girl summers. I was not talking to no professors. I was not trying to do research. This girl's about to help me analyze some data. Okay, like at the end of the day, that's what gets the wig. That's what gets the oil, y'all. It's that diligence, and that's what we're doing in Mother Lab. Everybody in Mother Lab knows what's our mantra, y'all. My job is to sharpen and tighten. I say that all the time. Sharpen you and tighten. When you leave Mother Lab, you can go into any discipline you want because you have had a broad exposure in many different areas. That's the world that we live in. Nobody wants a one-trick pony, honey, number one. Number two, nobody wants somebody that's not prepared for the assignment. Okay, so when you get in front of somebody, they get the traction. You get that meeting schedule. We all have people that we fangirl over. You better come and be prepared. You know what I'm saying? I remember one time I was in an elevator. This was at our American Public Health Association annual meeting. APHA was in Philly. This was, 2017. Guess who gets in the elevator with me? Just me, the Surgeon General of the United States, Dr. Regina Benjamin. This one, Dr. Benjamin was Surgeon General. She got in the elevator with me. I was like, Jesus. Now, 2 things had to happen in that moment. One, I had to be astute to know who she was, right? She's a Black woman. I'm a Black woman. If you're not up on who the leaders are in your field, I would not have known that she was the current Surgeon General. So when she walked out, I was like, that's Dr. Benjamin. So in my mind, I started running down all her act. I'm like, boy, she went to Tulane. She's a medical doctor. Like, I started running it down. Do you know by the time we got to whatever floor we was going to, okay, she knew who I was. I got her personal information. I got her to come give a talk at the time. I think I was teaching in Jersey. I got her to come give a talk to my class. I had like 30 seconds. And as soon as she got all her staff whisked her away, right? She's a surgeon general of the whole country, whisked her away. But honey, in that 30 seconds, she was my best friend. What did I tell you about that experience? One, luck favors the prepared. If you stay ready, you don't got to get ready. You keep your resume sharp. You keep your bio sharp. You keep your credentials sharp. Okay. You always perfect your field, your discipline, whatever it is that's in you. You become the master of that. Like Heather was talking about mapping, honey, you map your face off. You want to do qualitative research, find out who's doing research. How do I get on paper? How do I do this? How do I make this happen for myself? You scour your LinkedIn. LinkedIn is a free service, y'all. Get that headshot right. Get that tagline right. Get it right. That's your public face to the world. Stay off social media posting all that crazy stuff. Okay. I am so boring on social media. I'm kind of boring in real life. I got a baby. I'm old now. But my social media presence is very like mundane. You understand what I'm saying? Because I understand everything screenshotted, everything. I'm old. I came up in the age of MySpace. Okay, I came up in the age. Okay, I came up in the age of beepers, honey. You used to have to beat me. Okay, we didn't have cell phones. You couldn't screenshot, none of that stuff. That's the age I came up in. But y'all are living in a different generation. Everything is on Letitia's left. That's the age I came up in. Okay, I'm old, but y'all living in a different generation. Everything is archived. Do you know on applications, they're going through your social media, y'all, whether you know it or not. These employers are going through your social media feeds, honey. They're putting your name online and they're looking at and I don't think that's ethical, legal, whatever, but they're doing it. That's first of all. Second of all, be unapologetic about getting opportunities that you look for. Third of all, always, always be prepared. If I have been, you know how many surgeon generals I've met? Dr. Benjamin, like 5 of them. I knew who they were. I knew what to talk to them about. I got pictures of all of them. Like, I'm going to go to my annual meetings, my conferences. People call me Miss APHA. Because if we ever go to a conference as a lab after the pandemic, I don't play no games. I got breakfast scheduled, lunches scheduled, coffee scheduled. Why? Because this is the one time out of the year, everybody who's anybody in public health comes together. We all go to the conference. People flying from all over the country. So what do? I look at the attendance list. This is what I used to do when I was a student. Now people do it to me, so I think it's so funny. I used to look at the attendance list and say, such and such is giving a lecture on Monday at 4:00. I'm in the front row. When else are you going to get a lecture from the Surgeon General? When else are you going to get a lecture from the American Public Health Association? These people aren't so big. They got 10 secretaries. You can't get to them. But in this conference, we got 20,000 public health professionals coming together for 4 days in New Orleans, Chicago, whatever. And they just regular people. They walking through the exhibit hall with their kids. They got on jeans, like they regular and they're approachable. You gotta be ready. So those are some of the examples that I've done. And now when people do it to me, it just warms my heart because I'm like, oh, somebody looked me up in a little book or whatever. Like, Dr. Amutah, I see you're giving a talk at 12:15. I'm like, yes, sis, come to the talk. I'll buy you coffee after because I understand the assignment. The assignment is you want that FaceTime. You want to get that traction. You understand? So you gotta invest in yourself. All these things I'm talking about. What of this is fun and easy? You think it's easy to look through 10,000 attendees and see who you want to talk to? No. You think it's easy to keep your bio fresh, your CV fresh? No. But when you bet on yourself, you invest in yourself, you get the return. Your success is yours, y'all. The other thing I say in Mother Lab is, guess what? Me as your mentor, I'm always going to be in the car with you. I'm riding with you. I got my seatbelt on. I'm like, okay, where we going? But you in the driver's seat, honey. You driving. And guess what I'm going to tell you about mentorship? If you driving and we ain't going nowhere, I'm getting out the car because I'm going to get in somebody else's car. Okay? Or if you driving and you drive us off the side of the road, I'm getting out the car. Okay? Because I'm getting somebody else's car. But if you're driving us on a path that is sustainable, that is for your growth, I will always invest in my students. I go 200% for my students because I want you guys to have the opportunities I didn't have. I got all these degrees. I never had good mentorship. That's why I'm such a good mentor, because I never had it. You know what I'm saying? I go through all these schools, all these programs, very white institutions. All my degrees are from white schools, no HBCUs here. Nobody was checking for me. Everything I did, I had to find it on my own. I had to source it out on my own. I had to go for what I knew how to do. So now that I'm in a position to help people, I'm going to help as many people as I can. But you got to help yourself. You got to bet on yourself. So what you ain't got the experience, still apply. So what you don't think you can get in Mother Lab, still send me an email. This young lady, she's not even in Mother Lab. She's about to be on like 3 of my HIV studies. She was like, and if you got a spot in Mother Lab, holler at me about that too. And I was like, heard you, because she is ready. You understand? She's only like 20 years old. She said, I got nothing but time and energy. This girl came to the meeting today, y'all. I was like, well, Dad, what's my baby name? What's my husband name? Like, she just had so much information. She had done such, I was so impressed, y'all. And I was like, okay, sis, I see you serious. What's not going to get nowhere with somebody like me who got 50,000 meetings and been on Zoom for 10 hours? When you get on a call, you say, tell me about yourself. My whole life is online. Do your homework. Y'all live online? Social media, Instagram, TikTok, go to google.com and do your homework. That's going to get you the traction with people like me. And I'm telling you this out of love and out of sisterly love. You understand? As Black and brown women, my white colleagues, they just not going to respond to you. That's the truth. They just not, you just ain't never going to get a meet. You just ain't never going to get a response. You going to get the meet and they're going to, oh, okay. They're going to talk to you for 10 minutes. It's going to be flat and you ain't going to get nowhere. So this is what I'm telling you. You invest in yourself. You always show up for yourself. You always are prepared for the opportunity, because once you've made that first impression, you can never go back. People can't unsee what they've seen. You understand? So that's the thing I would say is like, don't, get out of your own head about the qualifications and the certifications. Go for what you know. Everybody is approachable. Everybody's on social media. If you can't get an email, slide in the DM on Twitter. If you can't get a Twitter, find their Instagram, find them on LinkedIn. People find me every kind of way. And sometimes I gotta ask them, how did you find me? Because it's such an abstract topic. They're like, oh, I typed your name in YouTube. I watched one. I'm like, cool. But people get the job done when you're clear about what the assignment is, right? And so, I'm just here to motivate and inspire, but I'm just telling you from what I've seen, the students that are the most successful are the ones that are hungry. That's what I'm building in Motherland. We all wolves. Be very clear. You understand? We might be a little more gracious and dainty, but we all wolves when you pull back them layers, because that's what I'm training. The world is not here for dainty people. You can be dainty with your family, but if you want to be successful, you got to have the wolf-like qualities. That's what we're doing in the Mother Lab. Thank you.
Dr. Ao dropped some gems. Thank you so much. No, don't apologize. Yeah, I just love listening to Dr. Ao talk. I feel like refreshed and ready to take on the world. But we just have 3 more questions before we open up to participants. So this is for Jaycina. What have you learned through your birthing experience that has helped with tender and just your lens on maternal health?
Yeah, so my 4-year-old is screaming. So if you hear her, that's her. So like I said, when I got pregnant, I was 20. I did like our Peach Care, which is like the state's free service. And I just had to go to an OBGYN office by my house. But I have a blood disorder. And I have low platelets. So basically my big fear was I'm going to bleed out after birth, right? And my OBGYN wanted to induce me because they wanted to give me an infusion of platelets and then induce me and schedule it. So that way, that takes it off the plate as an option. Me, at the time, like I couldn't afford a doula, but I read everything I could get my hands on. I was like, I don't want an induction. I declined like all the little drink the test thing. I declined all of this. And of course they're looking at me like, here's this 20-year-old Black girl, like being difficult. My appointments were like 10 minutes long. And every time I brought up what I was feeling or my concerns, I didn't feel like I was being heard. And so I switched late in my pregnancy. And I was scared to do that, of course. But I was like, I'm not going to risk it. I actually have the opportunity to switch, and now I can pay this how much it was to go to a midwifery and not use insurance. So it was like, this is what I'm going to do. And I had to take it into my own hands. And I think that experience just frankly like pissed me off that I had to do that, because it was like, I should have just been able to get the care that I deserved at my first doctor. And so I think that was my first starting point of being like, wait, this isn't okay, and what can I do? And so I think that always informs the work we do with Tender, because I understood how it felt to feel like unheard or not seen and not cared about. And so with Tender, we just want to make moms feel seen and heard and supported and wrapped in love and care. And so that's what we do.
Thank you. So this next question is for everyone, and it's just asking what skills that you think are particularly useful / have you all developed in this work path?
I'll let somebody else go.
I was gonna say, I'm not sure exactly what skills I mean, honestly, as a Black woman, it really sometimes is a skill just to be able to be myself every day, right? Like, honestly, to show up as me and know every person I see is happy to see me, wants to hear what I have to say. That's not, we don't always feel like that every day, right? And it's important to, whatever you have to do to make yourself feel comfortable with wherever you work, whatever situation you're going into, make sure you do that, because you need to show up as your full self every day. If you show up as your full self on Monday and Tuesday, but not Thursday and Friday, they're gonna notice, right? So make sure that that's, who you are is reliable, honest, and always you.
I think to piggyback on that, we talked earlier about like creating boundaries. So being able to do that in a way that you can separate time for yourself to be able to regenerate and refuel and re-energize. But on a strictly skill level, you have to be willing to be in a room where possibly no one else looks like you. And you have to be willing to say something, speak up, right? And have confidence in what you're saying. And I mean that, like, even when I'm in school, sometimes some of my colleagues have said very insensitive things. And I think that I don't want to be that person to be like, oh, yikes, but sometimes you have to. And so having the courage to speak up and having the confidence to speak up is really important. And then also, going back to that mentor thing, sometimes having the drive to want to reach out to that person to say hi, like the undergrad, like that's a skill right there. Persistence, that's a skill, and probably some investigative skills, right? Because she learned so much about Dr. Ayo, but on a very fundamental level, having the ability to just sort of ask, take the risk, I would say, are I don't know if they're necessarily skills, but things that I have done. My father will tell you, in every stage of my life where I've been presented with two paths, I always take the harder one. And it's not on purpose. I just have, every time we've thought about, when I decided where to go to college, I picked the more difficult one, in terms of adjustment. When it came to where I wanted to get my master's, I could have lived in New York City, DC, Atlanta, right? I chose Ann Arbor, Michigan, and then even still my doctoral program, I got into, Atlanta, I was these big cities where I could be this like socialite, but also be a scientist, research, public health hero. And I chose Harvard. That was a big decision. So I took the risk. And so I think being able to take the risk is half the battle.
Yeah, I have nothing to add. Very well stated.
So I have two more questions because I want to hear this, but how has COVID-19 changed you all's responsibilities?
I'll start and say life got crazy with COVID, and after, obviously, there have been a lot of babies this summer. Everybody knows somebody who is pregnant or is going to be, something along those lines right now. And so mostly like things went virtual. And then I really had to step up my education and advocacy, right? Because I was seeing people like, on the phone or on the computer, and up until I was in the room with them sometimes. So like, really, we would be like talking, and then they'd be like, okay, you could come now because you only be able to be here for, 18 hours or whatever it is. But I'm trapped in the room with people. Like we got tight during COVID, just because like, I'm there for the duration, whereas before I was coming and going. So really like talking about, doula, work and doula paying them and all that kind of stuff. It's a big responsibility being with someone in the room when their baby is born. It's a big deal to get to know someone to that comfort level that they're excited to see you walk in the room when their baby is about to be born. So all in all, COVID was great as far as how many babies are coming, but definitely crazy in how we've had to like, kind of manage virtual care with clients up until we see them.
Great. So just to end, and then after I ask this question, our participants can ask any if they have any questions. But what is some advice that you would give your younger self / any of us that are on the call right now?
I said it before, take the risk. Take the risk.
One thing I'll say, and I'm very proud of my older self and my younger self, because I was always pretty clear on my mission. Not that I had a very like straight path, but I always knew like the life that I wanted to have, right? I knew I wanted to be able to impact people, work with women, work with, in the field of maternal child. So I was always very clear, unapologetic about that. And, I remember after I got my master's, me and all my girlfriends, my crew from college, were all the same age. So I remember when I was starting my PhD, like, oh, you can have that. I'm done with school. I'm doing my master's, And I was like, all right, I'm gonna have it. I'm gonna do it. Like, I've always been like, I'm gonna do this by myself. If you want to come do this PhD, cool. If not, cool. Like, you are not born with the twin. Even if you are, your twin is still a separate person. So you got to move for yourself. You got to do things in your own time. I was like, I'm going to push through this PhD by the time I'm 30, because in my 30s, I'm trying to be making money. Like, I'm trying to get married. Like, the life that I have now, and again, there's no handbook for life, as it has not been a straight road, but generally I've been able to live the life that I want to live because I was really clear on my mission, right? Like, of course, I want to go to Jamaica and Miami and turn up, and I'm gonna get on one of these trips, but I can't go on every trip. I can't go to, Carnival every year. Like, I got things to do, but I was like very clear. And that's one thing anybody that would describe me would tell you, Dee is so clear on her mission. And it's not in a way that you do it to alienate people, but it's a way to keep yourself, it's a barometer for yourself, right? Like, I got to be able to look at myself and be like, all right, I showed up for myself today, or I showed up for myself in my career or my life. You know what I'm saying? So at the end of the day, when you bet on yourself, like I've been saying this whole time, you're going to have those results, but don't feel bad for being unapologetic. Like, somebody would have been like, dang, do I really need to get this PhD? Like, that's a little discouraging, right? When your whole crew was like, oh, you good on that. You got that, more school, more, you good on that. And I was like, all right, I'll be good on this PhD, honey. I'll be doctor by the time I'm 29. And I was. And so at the end of the day, it's like, you got to understand that at some point you're going to go on a journey by yourself. And, and everybody's not meant to go to every level with you. You know what I'm saying? Like, you got your crew, you got your core. I have my core group of friends. We've been friends over 20 years, but we all do different things. Our life paths have all been different. So I don't move in a crowd. You know what I'm saying? I wasn't born to be a follower. I've always been a leader. I've always been unapologetic about that. I lead with intention. I don't lead to step on nobody's toes, but you're not going to step on my toes either. So that's one thing I would have told my younger self is like, sis, keep pushing, take up space. You know what I'm saying? Don't be apologetic about, oh, I'm sorry to bother you. Why you bother me? That's what professors are here for. We work for the students. It's not a bother. It's part of our job. So you never downplay or apologize for getting what you need. You understand? You do it with grace. You do it with assertiveness, but you do it to get what you need, period. So that's one thing I would tell my younger self is, sis, keep your eyes on the prize. Always. You know what I'm saying? The prize is whatever you define. It don't have to be the money or the accolades or the career or the credentials, whatever you define as the prize, that's the prize. But you stay focused on that. You don't let nobody take you off your path. So that's the thing I would tell my younger self, keep it pushing. And people that's here with the naysayers and the distractions, leave them in the dust, honey, because they're going to be asking you for money in 3 years. That's the reality of it. Can you help me pay my rent? Can you help me pay my bills? Right. And we started off I have so many friends that I grew up with like that. Like, that's just the reality, is levels. And they still my peoples. I can still kick it with you when I come back around the way, but it's different levels. You know what I'm saying? You figure out the level you want to be on, and you don't let nobody take you off your path, right? Not your friends, not a partner. You stay focused, because at the end of the day, you got to live with yourself. You can't live for nobody else, honey. And we are all here on borrowed time. So at the end of the day, you want to be able to look back on your life and say, you lived it fulfillingly, right? So that's what I'll tell my younger self. Keep it pushing, sis, and get yours. Get paid, get your experience, get your network, so get what you need. And don't feel bad about it. Nobody else going to do it for you. Nothing in life is free. Everything in life is earned, right? So that's what I would tell myself. Don't feel bad for getting what you need.
Enough said.
So on that note, does anyone have any questions? You can either unmute yourself or put them in the chat.
I did want to add something that is not related to careers whatsoever, but I think it's really important. I wish I had told myself when I was younger that run your own race. You know, you'll see other people who everyone's going to achieve things at different rates, right? So I'll never forget when I was living in New York. This was like right after college. Well, maybe like a year after college. And I'm working like 6 jobs, right? Just trying to stay afloat. And I'm seeing people that I graduated college with, you know, on their way to finishing medical school. And I got really sad. And this was around the time I was trying to figure out, what am I going to do with my life? And I just felt like, gosh, why, if I had just stuck with, you know, that, I would be where they are. And I feel in retrospect, I've spent a lot of time like, dang, I really could have, or what if I had? And listen, what's meant to happen for you is going to happen in the time it's supposed to happen. And if you enjoy, I think I said that right. If you enjoy the journey, don't worry about what other people are doing, you know, people, especially like with families and things like that. If that's not, it'll happen in the time it's supposed to happen, and worry about what you're doing, what you're going to accomplish, being fearless in what you're doing, going for it, but worry about your race, because that's the only race that matters.
Thank you. There's a question for Dashanna in the chat. Have you ever considered the midwifery path?
Yes, of course. It makes sense. Like doulas and midwives like go hand in hand. But honestly, being a doula allows me to operate without the red tape, without the bureaucracy of a hospital, of policy, because being a midwife, you can either be a certified professional midwife or a certified nurse midwife. There are 2 different ways, at least in Massachusetts, to pursue. One, you can only attend home births. The other, you can really only attend hospital births. And neither one of those really works for me, right? Everybody needs a doula. Really, everybody could use a midwife. I mean, even if you're being seen, everybody could use the compassionate care of a midwife, to be honest. But if you're being seen in the hospital, you might get a hospital midwife who leans way more to the OB side. And I can kind of be all around that, you know, like in any situation. And I really kind of like that about being a doula. Yeah. But don't get it twisted. Like, doctors like me. I mean, you know, I go to the hospital. I'm not just crazy. You know, I go to the hospital. They know me. You know what I mean? Like, a couple of OBs are carrying my card in their wallet right now. You know, you have to kind of be able to do all of that. You know, I'm knowledgeable enough that they like, okay, your doula knows what she's talking about. But also on the side, I can be like, they don't know what they're talking about. You know? And both people trust me, you know? So I like that about being a doula. Yeah.
Okay. Are there any other questions? Okay, that's good. If not, we're just going to end this meeting. Thank you all so much for agreeing to speak to us. I know I've learned so much. So if you want to, again, donate to Glomed, the link will be in the chat, and we're going to give Iman a little bit of time to talk again about how you can support Mother Lab.
Thank you, Liz. I'm just gonna share my screen again.